HIPAA Security Rule Overview, an educational presentation brought to you by the Hawaii Health Information Exchange, May 27, 2022. This material is presented for educational purposes only and is not intended to be a solicitation for services or legal advice. The purpose of this presentation is to provide an overview of the HIPAA security rule. It is not intended to be a review of the entire rule, and viewers should consult their organization's policies before acting on anything discussed in this presentation. HIPAA Security Rule Overview. The key takeaways from this presentation related to HIPAA security are that HIPAA security provides a framework for the protection of electronic protected health information, EPHI. This is as opposed to HIPAA privacy, which is concerned with the protection of protected health information, whether in verbal, written, or electronic format. HIPAA security, just like HIPAA privacy, must be followed by covered entities and their business associates. HIPAA security defines safeguards and requirements that encourage the development of overlapping security controls in a framework that is applied consistently across an organization. HIPAA security defines the concept of required controls, which must be implemented in each organization, and addressable controls, which may be implemented if an assessment of risk determines them to be necessary. The acceptance or assessment of risk is a major theme running through the HIPAA security rule. Organizations need to be able to demonstrate that they have taken risk into account when assessing situations that could put PHI or PII in jeopardy. This approach makes HIPAA security different than other security frameworks, which may not provide as much leeway when determining if standards have been implemented sufficiently. The approach is an acknowledgement that covered entities come in all sizes and perform a variety of functions, which makes a one-size-fits-all approach unfeasible. The security rule established security standards for the protection of electronic protected health information, which was the first of its kind national set of security standards for protecting certain health information that is held or transferred in electronic form. A major goal of the security rule is to protect the privacy of individuals' health information stored in electronic format while allowing covered entities to adopt new technologies to improve the quality and efficiency of patient care. The rule requires that covered entities maintain reasonable and appropriate administrative, technical, physical and organizational safeguards for protecting EPHI. It is designed to be flexible and scalable so a covered entity can implement policies, procedures, and technologies that are appropriate for the entity's particular size, organizational structure, and risks to consumers' EPHI. Prior to HIPAA, no generally accepted set of security standards or general requirements for protecting health information existed in the healthcare industry. The security rule was published in 1996 in conjunction with the HIPAA privacy and administrative simplification rules. The security rule operationalizes protections needed to implement requirements under the HIPAA privacy rule. The security rule, as well as all the administrative simplification rules, apply to health plans, healthcare clearinghouses, and to any healthcare provider who transmits health information in electronic form in connection with transactions for which the Secretary of HHS has adopted standards under HIPAA. Health plans include individual and group plans that provide or pay the cost of medical care or covered entities. These include but are not limited to health maintenance organizations, HMOs, Medicare, Medicaid, Medicare Plus Choice and Medicare Supplement insurers, and long-term care insurers. Every healthcare provider, regardless of size, who electronically transmits health information in connection with certain transactions, is a covered entity. These transactions include any transactions for which HHS has established standards under the HIPAA Transactions Rule. The security rule covers a healthcare provider whether it electronically transmits these transactions directly or uses a billing service or other third party to do so on its behalf. Healthcare clearinghouses are entities that process non-standard information they receive from another entity into a standard, that is, standard format or data content, or vice versa. In most instances, healthcare clearinghouses will receive individually identifiable health information only when they are providing these processing services to a health plan or a healthcare provider as a business associate. Business associates of providers and health plans must comply with portions of the security rule. Business associates are individuals or entities that perform functions or provide services on behalf of covered entities, other than in the capacity of a member of the workforce, and that create, receive, maintain, or transmit PHI in the course of providing those services. When a covered entity uses a contractor or other non-workforce member to perform business associate services or activities, the rule requires that the covered entity include certain protections for the information in a business associate agreement. In the business associate contract, a covered entity must impose specified written safeguards on the individually identifiable health information used or disclosed by its business associates. HIPAA security defines a set of overlapping security controls intended to form a web of processes that create an integrated security framework. Processes are organized into administrative, technical, and physical safeguards. A separate set of requirements governing documentation and policies are categorized under organizational processes. Many of these processes have specific implementation specifications. These specifications detail obligations that covered entities need to be able to demonstrate compliance with, but because HIPAA security emphasizes that security implementations must be reasonable and based on an assessment of risk, not all the specifications are required. Some are considered addressable based on the outcome of a risk assessment. Administrative safeguards focus on processes required to properly organize an effective security program. Key requirements include naming a security officer who is responsible for overall compliance with the security rule. Because of the focus on electronic PHI, this individual typically needs to be familiar with information or cybersecurity controls. Having written security policies and procedures that are intended to prevent, detect, and correct security violations ensures that implementation can be accomplished even in environments with high staff turnover. Performing a risk analysis of specific situations is critical to being able to manage risk related to electronic protected health information under control of the covered entity. Education of staff is a critical foundation of an effective security program, and HIPAA puts much emphasis on the training of staff about all security policies and procedures. Having appropriate sanctions in place for violations of security policies is essential to ensuring that they are followed and taken seriously. Physical safeguards focus on protecting access to information systems and ensuring that the information they contain is properly managed. Ensuring that systems can continue to operate in the face of a disaster, such as an earthquake, through proper planning and facility controls is also a requirement under this section. A facility security plan and a business continuity plan are typical artifacts that can be used to demonstrate compliance. Key requirements include limiting physical access to facilities while ensuring that authorized access is allowed. Implementing policies and procedures to specify proper use of and access to workstations and electronic media. And having in place policies and procedures regarding the transfer, removal, disposal, and reuse of electronic media. Technical safeguards focus on security controls embedded within information systems. These controls focus on ensuring that access is appropriate, that ePHI is protected through the use of things like encryption and session timeouts. Key requirements include implementing policies and procedures that allow only authorized persons to access ePHI and to protect ePHI from alteration or destruction. Having mechanisms to record and examine access and other activity in information systems that contain or use ePHI. Implementing technical security measures to guard against unauthorized access to ePHI that is transmitted over an electronic network. This is a broad requirement that leaves the selection of the specific controls to implement up to the covered entity. The standards at 45 CFR Section 164.314, Organizational Requirements, and Section 164.316, Policies and Procedures and Documentation Requirements, are not included in Appendix A, the security standards matrix that is found at the end of the security rule, but must not be overlooked by covered entities. These requirements must be implemented to achieve compliance. Requirements include having written agreements in place with business associates and other contractual agreements, The Business Associate Contracts and Other Arrangements Standard requires a covered entity to have contracts or other arrangements with business associates that will have access to the covered entity's electronic protected health information, EPHI. The standard provides the specific criteria required for written contracts or other arrangements between a covered entity and its business associates. The actual language used to address the requirements can be tailored to the needs of each organization, as long as the requirements are addressed. Standards that group health plans must follow to ensure that their plan documents require the plan sponsor to reasonably and appropriately safeguard EPHI that it creates, receives, maintains or transmits on behalf of the group health plan. Implement reasonable and appropriate policies and procedures to comply with the standards, implementation specifications, or other requirements of the security rule. A covered entity may change its policies and procedures at any time, provided that the changes are documented and are implemented in accordance with this subpart. Specific policies and procedures are left to the discretion of the covered entity, but to be compliant, the organization needs to be able to demonstrate that they are being followed and that they do not permit or excuse an action that violates any other standard, implementation specification, or other requirements of this subpart. Time limits refers to how long documentation under the security rule must be retained. The standard requires that documentation be retained for a minimum of 6 years from the date of its creation or the date when it last was in effect, whichever is later. Availability refers to making any documentation available to personnel responsible for implementing the procedures to which the documentation pertains. And updates, or currency, requires that a periodic review be performed to ensure that the procedures remain effective in light of any environmental, operational, or other relevant changes. Risk management is one of the most critical concepts under HIPAA security. It recognizes that threats change over time, and that coming up with methods to defeat specific ones will not ensure long-term security unless an understanding of the root causes are considered. Risk is a function of 1. The likelihood of a given threat triggering or exploiting a particular vulnerability, and 2. The resulting impact on the organization. This means that risk is not a single factor or event, but rather it is a combination of factors or events, threats and vulnerabilities, that, if they occur, may have an adverse impact on the organization. The following are basic components in a risk management program. Plans can be simple or complex depending on the threats involved and the characteristics of the organization. Any risk management program should have authority over all people and resources involved with the security of electronic protected health information. The performance of a risk analysis is essential in all risk management functions. Analyzing risks during the planning, implementation, and incident response phases have many steps in common, but the methods used vary in extent and priority. There are many publications that address the performance of a risk analysis, and every organization needs to identify the approach that works best for them. As with all segments of the HIPAA rules, creating a compliance program is essential for being able to demonstrate that all individual efforts taken together result in an effective program. The common elements of a HIPAA security compliance program are: implement written HIPAA policies, procedures, and standards of conduct. Designate a person in charge of HIPAA compliance and provide them with the appropriate authority to carry out their duties. Train and educate staff on security compliance. Training should be appropriate for the job or role, and must be performed on a periodic basis. Create effective lines of communication between staff and compliance personnel. Perform internal monitoring and auditing activities. These include monitoring of staff and system performance as well as the performance of formal security reviews performed by people who operate independent of management responsible of operational activities. Properly define and enforce sanctions against employees who violate HIPAA policies and procedures. These sanctions must be consistent with human resource policies and must be implemented in a non-discriminatory manner. Develop a formal incident response plan that allows for a prompt response to problems and the timely implementation of corrective actions. To be effective, the organization's executives should be involved with the development and execution of this plan. HIPAA, more than any other regulation, sets the tone when it comes to the portability and accountability of health information. Few other industries have this type of overarching federal privacy regulation. This is important given the sensitivity that health information carries, and the fact that all of us depend on the healthcare industry from the moment we are born to the day we die. Understanding HIPAA is essential to understanding good quality healthcare. For more information on the HIPAA security and privacy rules, navigate to the links shown on the screen. This is the end of the presentation. Thank you for your attendance. Please contact us at the Hawaii Health Information Exchange should you have any questions or suggestions for additional topics.